My name is Dr. Kalitenko, and I'm a medical doctor, and I'm board certified in internal medicine, as well as holistic and anti-aging medicine. And what I specialize in is finding the root cause of the problem and treat the root cause. The reason why I'm telling you that is because when we deal with fatigued patients, which is quite a few in our practice, and a lot of patients, they come and they complain of fatigue. What we actually do is we try to find the root cause and treat the root cause, rather than give the miracle treatment that fits everybody. I'm in medical practice for about 35 years, and during that 35 years, I haven't found a miracle treatment. All right, and what I also found that there is no miracle treatment, and every patient is different. It's not a single patient in my practice who would be exactly like another one. That means that the solution of people's problems, they cannot be the same. It doesn't make any sense. Every person is different. And that's why, to solve fatigue, what we usually do is we just get history, physical. I'm an old-fashioned guy, and I more rely on what my patients are telling me than rely on the blood tests. I don't treat numbers. I treat complex human beings. And that's how it works. A young lady came to see me with unexplained fatigue. He was going from doctor to doctor, and she didn't get any relief. And she actually got married recently, and her husband was a guy who was younger than she was. So she was so fatigued that she couldn't perform her duties, and she was very afraid, and she was very upset about that because her husband was much younger than she was. Obviously, she was very concerned with her abilities, and she was trying to do everything possible to solve the problem. Because when she was fatigued, when she was coming back home after work and she was fatigued, she couldn't give as much love to her husband as she was supposed to. And the husband was much younger, so she was kind of jealous. She was kind of afraid, she was kind of anxious, and she didn't know what to do. So she was going from doctor to doctor with unexplained fatigue. She didn't get any help, unfortunately, and she was thinking that she was having Lyme disease because she was bitten by a tick, and that's why she came to me. She was treated for the Lyme disease with the traditional antibiotics, and she didn't get any help, and she was fatigued. So when I started questioning her, just what the problem I was trying to solve is fatigue, number one. That was number one, fatigue, then anxiety, and then the rest of the problems. And the number one suspect was Lyme. She was from Long Island, and you know that in Long Island we have a lot of Lyme disease because of a lot of ticks, so it's a very well-known problem. So what we did was, I sent her blood work to the best lab in the United States who was dealing with Lyme disease. We sent the blood work, and blood work came back, and guess what happened? Exactly. So we were trying to figure out why this lady was fatigued all the time. And we thought that maybe she had some kind of toxicity issues. But she was a young lady. She was not taking any medications that can cause fatigue. Later on, I will tell you which medications can do that. And there was no obvious reason. She didn't take any medication, she didn't smoke, she didn't drink, nothing that could suggest why that young lady was fatigued. We thought heavy metals. We took the provocation test, sent to the lab. Guess what happened? Nothing. No explanation whatsoever for her fatigue. So I started thinking that, I tried to analyze just, what it is coming from. And she was complaining of some kind of constant fatigue all over the day. And that was going against fatigue that is caused by hormonal imbalance. Because usually supposedly somebody has an adrenal fatigue, they have a very distinctive pattern. Later on, we are going to go over that pattern with you, so you might recognize it. So nothing was really suggestive, a little bit maybe adrenal fatigue, but not that much evidence of that. Because her fatigue was all over the day, from the morning to evening, so I started thinking that maybe she didn't get enough nutrients to feed their cells to produce enough energy. That was the working hypothesis. So what I did was, I requested the test to check her digestive system. And you know, it's very important because basically how we feel, it's like almost 90 to 100% is dependent on our digestive system. Whatever you put in your mouth can be your remedy and can be a poison. But it's not only what you put in your mouth, it's how your digestive system is working. Because if digestive system is not working, you just can't digest and utilize the best foods you can buy. Not foods, not supplements, nothing. So we were thinking that maybe something was wrong with her digestive system. So we sent the samples, her samples, it was 3 samples, and we waited, usually the test takes about 3 weeks. When the test came back, I couldn't believe what I saw. And the reason for that is because there was actually not that much wrong with her digestive system per se. Or nobody's perfect. Almost everybody who comes to my office has either small problems or big problems. But she had a totally different issue I didn't even think of, to be honest with you. Listen, I'm not perfect. I can't look at the patient and just look and say, hey, you have adrenal fatigue. No, I can't do that. But just it's the process. So she had parasites. That was kind of this idea didn't even cross my mind because she never left Long Island. She was born on Long Island, never went outside the Long Island. She never went to any other countries. So the question, how did she get it, remained a mystery. So when we got the results, the patient was asking, how did they get it? And I said that basically it doesn't really matter right now. You need a quick help. You need to get back to normal life right now. That's why what we did was, we just started her on antibiotics, and that was pretty much it. So this problem with fatigue was solved with antibiotics and because the lady had parasites. Listen, don't think that it happened in one day. Such things don't happen in one day. But little by little, she got her antibiotic treatment. We restored her good bacteria in the gut. We gave her probiotics. We gave her digestive enzymes. And little by little, step by step, she started getting better. And actually, her hormones, which were quite low when she came to my office first time, started going up on their own. I didn't even I offered her hormones, but she refused. She said, I want to do it natural as much as possible. And she started getting better little by little. So that small example can give you a sense how it works. So my point is that if you want to treat really fatigue, not to get a quick remedy, what you can do is to get an energy drink and get better probably. But probably it's not a good idea because in my understanding, young people, middle-aged people, and even elderly people, they are not supposed to be fatigued. Because I have my own idea about aging. I really do not believe that the speed we age is natural. What I think that we age prematurely. It's a long story, but let's talk about fatigue first. So I am dealing with fatigue almost every day. What I try to do is to get to the bottom, to the root cause of the problem of the fatigue, and then treat the root cause. Because advising a patient to give either energy drink or, in case of adrenal fatigue, to give hormones like cortisol, it's not what we usually do. Sometimes we do, but very rarely. And the reason for that is because quick fix in this case is not really a good idea. And here is why. Because supposedly somebody comes to my office with adrenal fatigue. I guess almost everybody here in this audience, they know what adrenal fatigue is, right? So the quick solution is to give the adrenal hormone cortisol, and the patients feel better next day. They feel like a different person, a lot of energy, they can do anything they want. But if the root cause is not solved, then what happens is that the effect of the treatment wanes with time. That's almost always happens, and whoever is dealing with low thyroid, he knows exactly that if somebody has a low thyroid, they start from a small dose, then goes up, 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 and up. That's the common thing. So in my understanding, what we need to do is to find the root cause, and that's why what I'm going to do is to go over with you over the patterns of fatigue, so you will get a sense of it and maybe some kind of practical tips how to deal with that. Drugs. Very, very common reason for fatigue. Not only street drugs. I think I don't need to talk about street drugs because street drugs are very common, and the people usually tend not to tell, and they think that if they use supposedly marijuana just for recreational use, it's okay. It's not okay actually, because marijuana brings testosterone level, especially for men, down very quickly. So street drugs like marijuana, even they're considered like a smoking and benign. It's not actually true, because men are probably suffering more than women, and testosterone goes down. Cocaine, heroin. I think I don't need to talk about that because probably nobody in this room is using that, and to tell you that it's bad, everybody knows that. What we are going to talk about drugs that a lot of people believe is good, and in fact they are not. Quite recently, not quite just about 2 or 3 years ago, there was an article in the New England Medical Journal, New England Journal of Medicine, the best journal in the United States, about the drugs, the whole class of drugs called statins. Anybody heard about Lipitor or Pravastatin, Zocor? Yeah. What this article was about is a very, very simple thing, that statins decrease, they actually block the production of vitamin CoQ10. Vitamin CoQ10 is necessary, absolutely necessary for energy production. No CoQ10, no energy. But the reason why that was published in New England Journal of Medicine was a little bit different. Because who is on statins, they usually have weak heart, right? Because of the high cholesterol. Weak heart. And if somebody has a weak heart, there is a big problem. If he cannot produce any energy, weak heart becomes a disaster, because actually it can't pump the blood. So what happens is that the patient goes into heart failure. That was that article about. So, statins, one of the most commonly used drugs, and as you know that they increased the indications for the statins, they now believe that, you know, almost everybody has an indication to take statins. But for your knowledge, guys, statins block production of CoQ10 and hence block the production of energy. All right? Does it make sense to you? So how did they find out? Very simple, because patients on statins, they had heart failure much more often than the patients who were not. All right? Now, the other drugs. The statins are probably the most commonly cited for this, for the energy, but for the energy blocking. But other stuff like the drugs that interfere with digestive system. Anybody knows the drug? Probably, in my understanding, number one drugs who interfere with the digestive system is any drug that lowers the hydrochloric acid production.
Oh, like Nexium.
Like Nexium, like a blue pill, like Prevacid, like anything that brings the neutralizes hydrochloric acid. Why? Because of the very simple thing. Without hydrochloric acid, you can't absorb magnesium, you can't absorb iron, you can't absorb a lot of metals. And metals, especially rare metals, they work as a necessary part of the enzymes. And with the enzymes, you can't really function, you can't produce any energy. And also, it's a problem with vitamins, especially B12. And you know that B12 is absolutely necessary for functioning. Okay? So that's the drugs that interfere with digestion and getting nutrients. Why? Not only because of the metals, but because you need, me, you, everybody needs hydrochloric acid to start the cascade of the digestive enzymes, because enzymes are not activated if you don't have enough hydrochloric acid. So if enzymes are not activated, the enzymes are produced in inactive form. Why is that? Because if it were made in active form, it would digest our cells. So what happens is that digestive enzymes are produced in inactive form. They go into the stomach or in the duodenum, actually. They're activated over there and then start digesting. So if this is broken, you can digest even the best food money can buy. All right? Is this crystal clear? That's a very important thing. If digestive system is not working properly, then no matter what you eat, no matter what supplements you take, because it just cannot be absorbed because of the problems with the digestive system. And this makes me to make a very interesting conclusion. Supposedly somebody has a problem with digestive system. So what happens next is that nutrients are not absorbed. So there is no way you can get nutrients. You need to produce energy. There's no way. Moreover, the problems start piling up. If somebody has digestive system issues, it usually goes along with bacterial overgrowth. Why? Because of the very simple reason. Because what hydrochloric acid does, it neutralizes the bad bacteria coming in. That's one of the purposes of getting hydrochloric acid and all that. This sterilizes the food. So if there is not enough hydrochloric acid, the bad bacteria start coming in, creating bacterial overgrowth. Does it make sense to you? What is the issue about that? A lot. First, it can lead to leaky gut syndrome. But in my understanding, even more importantly, who has bacterial overgrowth, they usually have problems with water-soluble vitamins like vitamin B group. Because B vitamins, they can be eaten by the bad bacteria. It happens to me because when I started trying to figure out why somebody has issues like fatigue issues or supposedly vitamin D issues, because a lot of patients, they come to see me and we find that the vitamin D levels are extremely low. The question is why? And patient is telling me, I can't believe what you're telling me, doc, because I'm taking 50,000 units of vitamin D every week. Yeah. The reason is very simple. There are actually two common reasons why a person who is taking a lot of vitamin D, they don't have enough it in their system, because of two simple reasons. Because vitamin D is a fat-soluble vitamin. So in order to get it in, you want to make sure that your digestive enzymes that digest and absorb fat are working perfectly. Whoever has problems with digestive enzymes, especially for the fats, he's in trouble because he just can't utilize vitamin D he's taking. But that's about the fat-soluble vitamins. Water-soluble vitamins, there's another problem. It's not enzymes per se. It's the bacterial overgrowth. What is the result of that? What is the problem if somebody does not have enough vitamin B group? It's a huge problem because it affects almost everything, vessels, the way we think. You know, vitamin B6, extremely important because of the very simple thing. What it does, actually, is promotes the conversion of the neurotransmitter, which is called glutamic acid, into the calming transmitter called gamma-aminobutyric acid. Anybody heard about GABA? GABA. Nobody heard? You know, like Xanax drug? It works like GABA. It makes us feel happy, but in a natural way. So if somebody has B6 deficiency, there is a trouble of making our own gamma-aminobutyric acid. And what actually GABA does, it's not always, it not only makes us happy. The main purpose of GABA is to separate the stimuli, the important stimuli from the not important stimuli. Supposedly, you're reading a book or listening to me. But while you're listening to me, there are a lot of other stimuli coming. Light, music, noise, a lot, right? But what you want to do is you want to concentrate on something, one thing, that is really right now very important. Because if you can't do that, there is no point to listen to the lecture, because you can't concentrate. That's what GABA does. GABA allows us to concentrate and pick up actually the right thing and take care of the right thing. That's a very important thing. And that's why vitamins we are taking and with food, it is very important. And also what we need to do is to make sure that they are absorbed and they are not wasted. They could be wasted because of the very simple reason, too many bacteria that are coming, that are residing in our digestive system. You know, those bacteria, they can play jokes with you. Supposedly, anybody heard about the disease is called kidney stones? Sure. Sure? Okay. So the common explanation why people have kidney stones is because they are eating too much spinach, they are not drinking enough fluid, etc., they usually recommend. In fact, what I'm going to say is you can go to Wikipedia or to Google and check what I'm saying. The problem why people have kidney stones is very simple, because normally the oxalate, which the kidney stones, most of the kidney stones are made from the oxalate. Normally, oxalate is digested in our digestive system by bacteria which is called Oxalobacter. If this Oxalobacter is killed by antibiotics, and most frequently it's Cipra. Everybody knows Cipra, right? So there is no such bacteria anymore, and oxalate cannot be digested anymore. So what happens is, instead of being digested and eliminated, It precipitates in the kidney and creates kidney stones. Guess what? When I tried, I have a few patients with kidney stones, and I tried to find if any factory, any place on the earth is producing Oxalobacter for the commercial purposes. Do you know what the answer is? No. There was a place in Canada, they shut it down. Okay, that's about the digestive system. So the digestive system is very, very, very much important. Just let me just get, and then I'll answer all your questions. That it's extremely important. And how do we take care of this? I promised you in the beginning to be as practical as possible, right? I remember. So the first, what you need to do is anything. It's regarding your digestive system, your toxins levels, whoever has toxins. You know, the most important thing is not to get rid of the toxins per se. The most important thing when you need to do is stop exposure. Do no harm first. That's the thing. Okay? And the way we can do in regards to toxins, just stop exposure. Stop exposure to toxins, and basically the people usually, it's very nice to deliver a lecture to you guys because you know what I'm talking about. If I'm talking about toxins, almost everybody knows what it is. It's mercury, lead, that's all the stuff in the plastic bottles, etc., etc. So first, stop exposure. Stop hurting your digestive system. And how do we do that? First, you know, you need to watch really carefully what you're eating. What is the problem? I remember I talked about the hydrochloric acid and the bad bacteria that were coming. There is another problem, huge problem with this, because bad bacteria often they become unresponsive and very resistant to hydrochloric acid. Guess why? Because, you know, the cattle, I will talk about what I know. I don't know everything about every foods. I'm not God, I don't know everything. But what I do know is about how they become resistant because of the way they feed cattle, they feed cows. I was born in Ukraine. And in Ukraine, from my childhood, I learned that a cow eats grass. When I came to the United States, I learned that actually they're not eating grass anymore, and they eat corn. No, grains. What is the big implication? What is the result of it? The result of it is the change in the acidity in the gut of the cows. And what it does is that because of that, the bacteria actually become more resistant to hydrochloric acid. So as soon as they are taken into our mouth, they are already resistant to hydrochloric acid that can go through. That's a very important thing. So my absolute, I'm not giving you any medical advices, guys, but what I do for myself is I try to eat grass-fed beef because of the reasons I just told you. There is another reason for that, because it was a very interesting thing that they couldn't figure it out. You know that we need omega-3 fatty acids to function, right? So it was we get it from fish most of the time. So the question was, okay, that's understandable how the people who live by the ocean, how they get omega-3 fatty acids. What about people who live inside the continent, who don't have access to fish? Where do they get omega-3 fatty acids from? No. The answer is very simple. If a cow is grass-fed, there are plenty of omega-3 fatty acids in her meat. Simple is very, very, very clear. So basically what I'm driving at, just try not to hurt your digestive system in the first place. What I do for myself is I try to stay away from any processed food because of the very simple reason. Because, you know, let's talk about proteins. You know, the proteins have the structure, the certain structure. And the digestive enzymes, they are designed to deal with this structure. So if this particular structure of the protein is changed by heat, our digestive system, the digestive enzymes, cannot digest proteins as effectively as it should be. So what I do for myself, I try to stay away from foods that are overheated. Personally, what I do, if I cook, I try to use as low temperature as possible. And what I recommend basically every one of my patients called the way of cooking is called sous vide. It's a plastic bag, you put it in if you are afraid of plastic, I usually take a mason jar and put it in a mason jar, put it in the sous vide machine, and you can actually cook if you want the foods at a very low temperature, preserving that, at least try to preserve it. There's no way it can be perfect. Okay, so foods, try to avoid high cooking temperatures. That will help digestive system. So grass-fed. Fish. Just make sure the fish you eat is safe. How do we deal with that? The smaller fish is, the safer it is. Because of the very simple thing, why fish has toxins? Because of the bioaccumulation. Fish grows bigger. The more fish grows bigger, the more probable it is that it's poisoned. So the smaller fish you take, and one of the safest fishes, you know, it's catfish, probably one of the safest. Okay, and just try to pick up the small one. So basically, go by the size. And of course, I don't eat personally. I don't even touch tuna or something like that. Wild Alaskan salmon is a good choice.
What about Fukushima?
What about what?
Fukushima, the Japanese nuclear plant.
Well, look, you know, I don't know the perfect solution, you know, but you still need to get omega-3 fatty acids, you know, so you probably have to figure out which is the best way. There's probably no, at least I don't know the perfect solution of this. I try to get it, you know, wild Alaskan salmon, you know, just I get Spanish mackerel. You know, that's a lot of fatty. You know, yeah, the small one, they pick up the small one. You know, the small fish. That's what I try to do. Probably there is no the solution. So that's number one. And the reason for that, why it's so important, because if you have enough nutrients, you're kind of, you know, you will get better because you have enough stuff to get better. First of all, you know, your body is so perfect, it actually knows how to deal with this. You know, your body is very smart, my body. So do you think who is smarter, me or your body? Obviously, your body or my body is smarter than me. That's why what I would suggest is try not to hurt not to hurt your body first. Fatigue. So just watch what you eat. What I came up with, very interesting idea. What I do, I almost 100% what I eat is I do myself, because when I go out, I never can trust those guys. They can put a lot of stuff. You know, yesterday I was guilty actually. I ate a steak from outside. It was so tasty, you can't even imagine. But the result was, I didn't sleep well. And I suspect, listen, I can't prove it, but I think they put some MSG in it. So watch for MSG, because I already know when I just get occasionally, accidentally MSG, I know that feeling. That's totally different. So watch what you eat. Now, the second common reason for fatigue is inflammation. That's basically what we do. If we can't find the reason for the chronic inflammation by checking nutrients, checking vitamins levels, it's inflammation. Where can it come from? I had a 21-year-old guy who came to see me with extreme fatigue. He couldn't sleep, He couldn't do anything. He couldn't even attend his school. But it was quick. Even the first session, I figured out that all his symptoms started after he had some teeth work done. So I told him that most likely reason, after just getting the blood results, it was highly suggestive of inflammation. So I told him, what you need to do first is to go back to your dentist and if you check if you have an infection over there. Guess what happened? They did the x-rays. It was a cyst filled with pus. The solution was very quick. The guy got better in a few months. They just drained it. And that was it. So teeth are very common reason for fatigue. Why? Because, first of all, root canals. Root canals, they remove the vessel inside, so actually it's a dead body. What will happen? Nothing good. I had this problem personally. I was stupid enough to allow to put the root canal. And I started feeling fatigued. They couldn't figure out what was going on. Turned out to be a cyst filled with pus. So they removed the tooth because of the pus. And guess what happened? They removed it in a way that they created a hole between my oral cavity and my sinuses. So that's be very careful with the root canals. And another problem is, unfortunately, if somebody has an inflammation, the bone can be affected too. There is a kind of slow-going osteomyelitis. It's quite common, not very common, but quite common, that creates an inflammation that it's extremely difficult to detect. Can go undetected for years, and nobody actually can understand what's going on because of the particular site. It's very hard to detect, even with the CAT scan.
Did it fill out with arsenic?
What's that?
Your cavity was, your root canal was filled out with arsenic.
That's, I don't know. I can't comment on that. But what I know is that I ended up with a cyst filled with pus. The second most common source is sinuses. Sinuses, because of the very simple reasons, because of the either nasal septum deviation or polyps. I had a patient who came with excruciating headaches. We couldn't figure it out what it was. We checked everything until, it was actually sinuses. There were polyps, blockage. There was a blockage, and there was no drainage. Drainage was blocked. There was no way because the sinuses were drained, created huge headaches, fatigue. She couldn't function. She couldn't work. She couldn't do anything. Simple reason. She went to surgery. Blockage was relieved. Infection was gone, done. Cured. Okay. So how do we deal with this? The pattern of this fatigue is totally different from the pattern we have when we have a nutritional deficiency or secondary to drugs. Usually, if somebody has problem with the drugs or there's not enough, usually the fatigue is quite the same during the daytime. Listen, there is no laws. In medicine, there is no rules. Don't even think that there is any rules. No. It's war without any rules. So this is usually typical for the kind of constant problem like no nutrients, enzyme deficiency or something like that. Who has an inflammation, it's a totally different pattern because this patient is usually presenting with the horrible morning fatigue, and they usually feel better by the evening. So they consider themselves as an evening person. What is the reason for that? That's because of the very simple thing, because they don't have enough cortisol in the morning. This condition is called adrenal fatigue. Very simple. So this pattern is totally different from what the pattern we see if somebody has any digestive issues or, God forbid, tumor. I had a patient of mine who came with horrible fatigue. And she was going from doctor to doctor, and the source of fatigue was not discovered. So she came to me eventually, and she looked at me, so, another doctor promises everything, does nothing. Okay, I said that, listen, I'm not God. I cannot promise you anything, but we will look into the source of your fatigue. She was not actually fortunate. What happened was that she had a tumor in her pituitary, which prevented her from producing cortisol. That's why she was depressed. That's actually one of the reasons for the depression. Actually, she came, one of the complaints were actually not about that fatigue and more depression. She was thinking about seeing psychiatry. So I learned that depression sometimes has nothing to do with the brain. It has a lot to do with the cortisol. So she had tumor. So basically what we did, we managed this issue, and she was stabilized. At least she's not getting better. But that's a kind of very rare. Not quite rare, but it happens like in the last year, I think I diagnosed a couple of persons, 2013, a couple of persons, yeah, a couple of persons with the pituitary tumors. That was the reason for fatigue. So it's kind of complicated. But what you can do no harm first. Take care of your digestive system. Get rid of the toxins. And if it doesn't work, or maybe if you have an unresolved health issue, get somebody who can look for the root cause of your problems instead of giving you energy drinks or some kind of temporary relief. Thank you very much. And any questions? Yeah. So that makes me think that eating, if you stay with meat only, it's not a good idea. So the more versatile you are, the probably better. So what my point is not to stick with this kind of particular type of foods. I don't think there is a miracle food that can make you happy, can make you full of energy, can make just have better sex life. No, I don't believe in this. What you should do is what I do for myself, is to be as versatile as possible. I try to eat everything I have. Nuts, seeds. Listen, I eat meat. Most of my foods are plant-based. So when I get up, I eat first every day oranges, 1, 2 oranges. That's my favorite. I can't survive without oranges. I don't know why. But oranges first, apples, almonds, fish. I eat raw fish. I don't advise anybody to do that, but I try to stay raw. I am trying to get raw about 70% of my foods. Okay, but I don't recommend anybody to go raw because of the very simple reason. You can do it on one condition: if you have a healthy digestive system. What if you don't? Then it's going to hurt because you can't digest that raw foods. That's what I do for myself. Any other questions? Yes?
What about if somebody has Epstein-Barr?
In my understanding, any chronic infection, including Epstein-Barr or Lyme, yeah, I'm finishing, or anything, is because of the immune problems. If somebody doesn't have enough, good enough immune problems, they cannot clear it up. That's why what I do with the patients who come with chronic infection, I fix their immune system. And the 80% of the digestive system, and the immune system is in the digestive system. It's here, in the gut.